Over the years, our family's had a share of health problems.
So prescriptions are a part of our life.
Before we went to the big box store.
We both thought it would help us save. But with the long lines and impersonal service, filling prescriptions became a chore. That's when a friend recommended D&H.
Now Tristan knows our prescriptions. Brenda always helps us find the right vitamins. And after Dad's fall, Monica's been a real expert with all our home medical needs. All without the lines.
Trust and service.
That's our D&H.
And welcome to Radio Friends on Thursday, August the 14th. We've got one guest today, and a very nice man. This is Dr. Marcus Wade from University of Missouri Healthcare. Good to have you here, Doctor.
Thank you very much. Pleasure to be here.
It's my pleasure. And I was talking about lung cancer, and you were telling me before we came on that lung cancer is one of the biggest killers of people in our country.
Correct, yeah. Actually, about 25% of all cancer deaths are related to lung cancer. That's about 168,000 people per year actually related to lung cancer. And so one of the things the university is trying to do is to help to detect that type of cancer early and cure it before it can spread and cause problems.
Is the biggest cause of lung cancer smoking or secondhand smoke?
Absolutely. It's probably responsible for about 80%, maybe even more. There are some other minor factors, but overwhelmingly it's related to cigarette smoking.
80% of lung cancer is brought on by smoking, whether you smoke or not, but if you're in the room or you're in close proximity of secondhand smoke, you have a chance of developing lung cancer.
True, yes. Secondhand smoke, it's not as much as if you smoked yourself, but yes, there's still a chance.
Are there any early warning signs?
No, unfortunately, lung cancer, it's pretty unusual. You'll just have shortness of breath. Some people cough up a little bit of blood, but overwhelmingly, it's one of those cancers that really would just detect it either on an X-ray or a CAT scan.
So there's no warning signs at all?
No, very few. There are some type small cell cancer that will have some funny symptoms, but there's no consistent symptoms to expect for lung cancer.
So the university is offering free, is that right, free screening?
Correct, yes.
Free screening for lung cancer.
For a long time, we really didn't have a good screening test for lung cancer. They tried chest x-rays, it didn't work. And they wanted to do CAT scans, but it was kind of a lot of radiation to give people serially every year. But with the new CAT scan machines we have now, the new protocols, we've developed a way to do it with a very low radiation dose. And recently some big studies have come out that's shown that there's definitely a benefit to finding those lung cancers early. And we're working to really target just a select group that will benefit from lung cancer screening.
A select group?
Correct.
So not everybody needs to be screened for lung cancer?
Not all smokers need to be screened for lung cancer.
Okay, what if you're not a smoker? Should you be screened for lung cancer?
No, it's probably not beneficial if you're not a smoker. The chances are very, very small. In fact, the people we're looking for are people of 55 to 74 who have been pretty heavy smokers throughout their life, what they call a 30-pack-year history, somebody who smoked a pack a day for about 30 years or 2 packs a day for 15 years. And we're looking for those people, and only if they've quit within, they're either an active smoker now or if they've quit within the past 15 years. So really, once you're 15 years out from smoking, the odds of you getting lung cancer are very small, and so we don't recommend screening for people who are that far out.
So if you've not smoked at all, or what if you don't smoke, but you've been around people who do smoke, then are you a candidate for screening?
No, because your odds are still very small of getting lung cancer, and even when we target such a high probability group, there'll still only be a certain percentage of lung cancer we're going to find. And so really, if you're not a smoker or if you quit smoking a very long time ago, you probably wouldn't benefit. It's just for people who are actively smoking or have quit within the past 15 years.
So if you're actively smoking or you quit smoking within the past 15 years, you can have a free lung cancer screening at university.
Correct.
And so what do you do?
Well, with the new CAT scanners, they're very sensitive and allows us to use very low radiation to take just a normal CAT scan of the chest, but with very low dose. And we use that to look for nodules or masses in the chest. And what we'll be looking for is anything that's abnormal. And one of the big problems with screening programs is sometimes you'll find something, you're not sure if it's good or bad or anything like that, and you really aggressively try to follow it up and do lots of other tests. With lung cancer screening, one thing we're really focusing on is we're only going to follow up things that we're pretty sure that need to be followed up. And so our CAT scans will look for, if we see a mass right away, we can tell you. we'll refer you to the pulmonologist, and they'll follow you up. And if we see something that's just kind of suspicious, we'll either follow it up in a year, because this is a program much like mammography. We do one CAT scan every year. So if it's something that's unlikely to cause you problems, we just let it go and we just look at it on the next CAT scan in a year. If it's a little bit suspicious, moderately suspicious, we might follow it up in 6 months.
So if you are diagnosed with lung cancer, how do you treat it and how do you cure it? Or is there a cure?
Well, there's definitely cures for it. The question is how far along the cancer is. Is it just kind of within one spot of your lung, which is typically early in the lung process, early in the cancer process, or has it spread throughout the body? The easiest and most likely chance of getting a cure is when it's early and small and still just focally present within the lung. And so this lung cancer screening kind of focuses on finding those cancers. At that point, they can either, most typically, they'll cut it out surgically. And they can also use radiation therapy for some cancers, depending on how bad their lungs are, if they have other emphysema or something like that. Sometimes they'll just use radiation and chemotherapy to try to kill it. And the smaller it is, the more likely they are to get a cure. Now, if it's spread to some areas, like within close to the heart, they still have a pretty good chance of getting cured, depending on just how far it's spread and what type of cancer it is. But in general, your best chance is if you get it small and when it's still within just one segment of the lung.
What you're telling me here is that smoking is not good for you.
Correct.
It's not good in any way, shape, or form. And it's so hard if you are, it's not, I never smoked cigarettes, so I don't have that problem. It's easy for me to say, well, you got to stop smoking. But if you're a smoker, it's not that easy to stop, is it?
No, not at all.
Even if you know that you're causing harm to yourself, it's not easy to stop.
And actually, as part of our screening program, you'll often have the opportunity to be referred in for a smoking cessation program that the university runs, and they offer for free as well. And a lot of people get more motivated when they see their CAT scan. They see that their lung has problems, has emphysema, or part of the lung is kind of scarred down and broken down, doesn't work as well. So hopefully, as part of this, it encourages people to stop smoking, and we will offer resources for that.
So if somebody listening to us right now is a smoker or had stopped smoking within the past 15 years, they want to do the free cancer screening test for your lungs, how do they go about it?
Well, most of the doctors in town will be aware of how to order it, or if they want to call us directly, they can just call 884-1140.
That's University Hospital.
Correct. University Hospital, 573-884-1140, and that'll be our nurse coordinator, and she can get you set up with a CAT scan.
Okay, and there is absolutely no charge to this?
No charge. It is actually covered by some insurance companies right now, but it's kind of a hassle for the patients. They may have a copay, so the university decided we'll just make it free for everyone to begin with. It's just something they really believe in and they wanted to support.
All right. Dr. Marcus Wade, thank you so much for coming by.
Thank you very much.
Thank you for the good information, and hopefully we help somebody listening this morning. Okay. All right. We're out of time for today. Let's see. Tomorrow, well, we're going to talk with the Central Missouri Astronomical Association, Val Gurman, and show you some good pictures. Our program directed by Travis McMillen, Reynolds Journalism Institute. Audio is Pat Akers from KBIA. Our floor director is Daniel Shapiro, and our assistant producer and guest coordinator, Uncle James Mauser. Bye-bye.